walang duda maganda ang plano ng Panginoon sa atin. But may plano din kasi ang demonyo sa atin eh. So it's also the choices that we make, the priorities that we choose, di ba? Became a Pontius Pilate, naghugas kayo ng kamay. Hindi nyo pwedeng i-threaten yung Makati Hospital na hindi nyo bibigyan ng lisensya unless tanggapin nila yung MAIP. We thought you were a Solomon. Now when two mayors with conflicting claims come to you and they say, hatiin na lang yung bata, yung isa sabihin, wag hatiin, yung isa sabihin, sige hatiin, you be a Solomon at kampihan mo yung nagsabing, wag hatiin. Kasi yun ang tunay na nanay eh. So you have one mayor who says, hindi na kayo Makati, bawal na kayong paggamot dito, hindi namin babayaran, hindi namin tatanggapin MAIP. You have one mayor who says, ikandado na lahat. And what did you become? Not a Solomon. You became a Pontius Pilate, naghugas kayo ng kamay. Hindi nyo pwedeng i-threaten yung Makati Hospital na hindi nyo bibigyan ng lisensya unless tanggapin nila yung MAIP. Saan nga nakakita, binibigyan ng MAIP, ayaw tanggapin. You're telling me that the DOH is helpless? Mahiya naman tayo. You have a 300 billion budget, kayo nagre-regulate ng hospitals all over the country. An ordinary hospital director can say you, wait hanggang mamatay kayong lahat.
We recognize Secretary Herbosa and you may proceed, Senator Cayetano.
Again, good evening, Mr. Secretary. Good morning.
Good morning,
Mr. Secretary, you've been Secretary for a little bit over a year.
Yes, a little bit over
Yes.
since June of 2023.
So what for you, sir, is the biggest or top three biggest threats to public health and to basic human development?
So for us in the Philippines, it's going to be the low rates of immunization, the stunting, the high rate of stunting in our children. About 3 out of 10 children have stunting. And also maternal mortality, which has gone up again.
Okay.
I would put that as the
So
top three.
this is a good start because I totally agree with you. I asked top three kasi baka hindi man tayo mag-agree sa first. But can we put the slides while I'm talking lang, no? You know, I always start the presentations with Jeremiah 29:11. He is a prophet that the Muslims, the Christians, and Jews all respect. Sabi niya, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope in a future." The reason I like mentioning this is because walang duda maganda ang plano ng Panginoon sa atin. But may plano din kasi ang demonyo sa atin eh. So it's also the choices that we make, the priorities that we choose, di ba? So for me, I attended a event, I had the privilege of listening to President Tharman of Singapore, and this is his quote: "The highest social return we get on any investment comes in maternal health and in the earliest stage of a child's life, with the first 2 years in particular being absolutely critical, the earliest stage of life, in fact, the prenatal period." No? And he was talking here about stunting. And he's a finance guy. Eh? So he was basically saying, he's an economist, a finance guy, so he's basically saying, kahit merong kang free college, kahit merong kang puhunan para sa mga gusto magnegosyo, kahit merong kang mga interventions, kung stunted na yung tao, affected na yung health niya, affected yung mental capability niya, wala nang intervention there. No? The problem is, in the Philippines, 1 out of 3 Filipinos is in danger of being of stunting. No? Can you go to the next slide? I'll just show you this para mapabilis, but just so that we're all in the same line. No? So eto po yung, no, the one before that, please. Yan, so parang 0 to 5 years old, 26.7%, 0 to 5 months, 8.9, so on. No? Apparently, this statistic hasn't changed that much. Am I correct?
Correct, Mr. President.
Yeah. So let me skip to Einstein. Einstein said stupidity is keep doing the same thing and expecting different results. So I don't want to be accused of having a stupid Congress if we were going to just keep approving the same programs and expecting na biglang mawala na lang yung stunting sa ating bansa or bumaba, di ba? So what are the immediate things we do need from the DOH para bumaba yung percentage at eventually mawala yung stunting?
Mr. President, ang key dito is the focus on the first 1,000 days or the first 2 years of life, which starts with the intrapartum, nasa buntis na nanay, to be fed correctly, to be given micronutrients, and then pag napaanak sila, to be given mandatory breastfeeding with proper nutrition for the mother, and of course, the vaccines for the young kid before the age of 2 makompleto, and then full nutrition
Okay.
for the kid.
I cannot disagree. You're the expert on that, and I will not debate on that, but I will go through that. So you mentioned nutrition. Pero yung budget nyo sa Nutrition Council, bumaba, hindi tumaas. Correct? Your finance guy is somewhere there. Tama ba? Yung budget nyo for next year for the Nutrition Council, bumaba, hindi tumaas. It's not even the same. It's lower.
So there's also another project, another attached agency, which is the National Nutrition Council,
Yes.
which is starting to do hapagkainan, which is a program.
Yes, but the
And then
budget for the
so may
Nutrition Council went down, right?
Asan ang NNC?
478. 313 sa NEP. Pero tinasan ko eh.
Yeah. Sa NEP, bumaba siya.
Yes, Mr. President.
Oh. So, was this the DBM or was this your Chair 1 and Chair 2?
This was I think, Chair 1, Chair 2.
No, so, which is it? Kasi pag Chair 1, hindi dapat binaba ng DBM yan. Pag Chair 2, kayo may kasalanan yan kasi nilagay nyo ng Chair 2. Did you submit it as Chair 1 or Chair 2?
Asan ang nutrition?
How much did you submit as Chair 1 for the Nutrition Council? So, we can get back to that, but
Yes.
can you go to the next slide? Next slide. Next slide, please. Next slide. Next slide. The one that shows yung NNC, DOH, at DSWD. So you talked about the first 1,000 days. You have a program, right?
Yes, Mr. President.
And then, Mr. President, the budget is 977 million.
Yes, Mr. President.
So the total budget of the DOH is
I think there's 300 in NNC.
300 something billion.
Something in NNC and 900.
And
in-
MAIP alone is more than 50 billion, right?
That is correct, Mr. President.
So given that the biggest threat is malnutrition, is maternal issues with the mother, and also the first 1,000 days, does it make sense that you submit a budget for 1 billion for the first 1,000 days, then 50 billion for MAIP? Parang it doesn't make sense. It doesn't add up.
I think maybe the explanation is that the feeding programs are with the Department of Social Welfare and Development. So that gets the higher budget. The food given to the indigent and the zero hunger I-8.
Yes, Mr. Secretary,
interagency.
that's the feeding.
The
But
DOH,
the provisions for vitamin A,
Correct.
micronutrient, etc., is all with the DOH.
Correct. So that's what I'm trying to explain, Mr. President, that the DOH takes care of the micronutrient supplement, the advice for health promotion on what to eat, but the food itself for nutrition comes from the DSWD.
So my point is, Mr. Secretary, you have more than 300 billion, you have 50 billion for MAIP, you only have 1 billion for the first 1,000 days,
1 billion.
and we're saying 1/3 are stunted. And we're saying hindi bumababa. So does it make sense for us to pass the budget that you're suggesting, given that 1/3 pa rin masastunted kung tayo masusunod? And MAIP will continue to go up, di ba? Because if you become permanently stunted after 2 years old, you will be more prone to chronic diseases from malnutrition. So that means yung gastos nyo ng PhilHealth will also go up in the future.
Mr. President, what's unique about the hunger budget or the nutrition budget? It is divided to several agencies. Even DepEd, well, hindi ho nakalagay dito. DepEd
Yes,
also
but
had
the
a
lead
school ed-
agency is DOH, Mr. Secretary.
Our role in the interagency is really for the Philippine Action Plan for Nutrition, which is the plan to really lower the maternal rate, which is done by the Nutrition Council. And in the Nutrition Council, ang nakaupo din po doon, these agencies I mentioned. So, kumbaga nagtutulungan po,
No.
Mr.
Yes,
President,
Mr.
yung mga
Secretary.
agencies
The
to help
problem,
a
Mr. Secretary, is-
whole-of-government approach.
Yes, sorry to interrupt, Mr. Secretary, but the problem is, I was also once, albeit just for a short time, a cabinet member. There has to be someone to take the lead. And ang lead ng DSWD is yung mga sector na vulnerable. Ang lead ng DepEd is education. So yes, may role sila. In fact, I narrated kanina, dapat yan DOH, LGU, DILG, DSWD. Pero ang lead dyan ay DOH. Kayo na nagsabi yan, yung top 3 eh. Pero yung budget nyo does not address this as a top 3. So, for example, no, kanya-kanya tayong idol. All of you sitting there, if you take out your present secretary and I ask you who is the best secretary of health, we'd probably give different answers. But for example, in terms of getting the public to know the issue, siguro 2 out of 3 of us will answer na Senator Flavier was really a cut above the rest. So when he wanted people to get vaccinated, gumawa siya ng commercial. He went out saying na dapat may turok. When he wanted to go anti-smoking, he didn't care about the tobacco lobby. He did the Yossi Kadiri. Kung hindi pa ako nag-attend ng isang, and I'm admitting my own failure. I've been in government in 1992. I should have known this issue. I should have done it earlier. But kung hindi dahil kay Professor Alvin Ang ng Ateneo School of Economics, when he presented this data in one of the conferences of Transform Nation, and if I didn't attend the speech of President Tarman, it wouldn't have hit directly in my heart, no? But my pain is simple. We're going to just repeat it next year, and 1/3 na naman is going to be endangered of stunting. Okay, let me relate this now to PhilHealth. Mr. Secretary, you are the chairperson of PhilHealth, correct? Of the board.
Yes, Mr. President.
Okay. When was the last time that PhilHealth did a survey of prices? Prices sa hospitals, sa diagnostic tests, sa treatments, etc.
They do prices. They do surveys of pricing all the time. Every time there is a benefit package
When's
review.
the last time that they did it?
It's done regularly. For
No.
each benefit
That's not
package.
the answer. Apparently, you don't know. When's the last time they did it?
Alam niyo.
No, you're the chairman of the board. So this isn't one, please don't answer sa PhilHealth and Yusek. He's the chairman of the board.
Yeah.
Malaki ang skandalo ngayon ng PhilHealth dahil nga pinababalik yung perang 80 billion, di ba? More or less.
89.9.
89 billion. So I will link this to the no balance billing. The reason I'm not asking the CEO is because I've asked him this twice already. One in my committee when I used to lead the GOCC committee, and once in the health committee. No? So we are in an understanding na. But you as chairperson and as Secretary of Health should know this issue. When was the last time na nagkaroon ng comprehensive na survey sa price ang PhilHealth para gamitin ito doon sa pricing nung ibabayad ng PhilHealth sa case?
If it's a case rate, it was in 2012, 2013.
Yeah, so
I was undersecretary then.
Okay,
and
it's
we knew we did that.
2013, 2014.
Correct.
Okay?
Correct, Mr. President.
So that means na pag-iwanan na tayo ng price, correct?
That's correct, Mr. President.
Okay. So nung nagka-problema 89 billion at the start of this year, instead of doing that comprehensive survey for the case rate, what PhilHealth did is just increase across the board 30%.
That's correct, Mr. President.
Oh. And 30% is not accurate.
30% is just the recovery of the unincreased for the past 10 years.
So how much was a bypass operation in the heart center in 2013?
I think about 500, 600,000.
I think much less. Kasi ang sa package nyo is 60,000, di ba? For, how much is sa package nyo for, the PhilHealth can answer this. Magkano yung package nyo for bypass? Before the 30% increase?
Easy package.
More or less. Pakitignan na, sir. Magkano yung yung babayad nyo ngayon, and magkano ngayon, pag ngayon ka magpapabypass sa heart center, magkano na?
550, Mr. President.
550 ang covered nyo.
Ang covered before.
Now.
Now.
Oh. How much is a bypass ngayon sa heart center?
About
1 million?
1 million, 750 to 1
Oh.
million, depending on your category.
Yeah. So, malayo dun sa 30% nyo. This is my point. I used to call it zero billing, but the right term is no balance billing. Ang ibig sabihin ng no balance billing, kung ako pasyente at within the case rate, and the case rate should be the average, wala na akong babayaran. I can walk in and out of the hospital, or if they have to wheel me in, hopefully I can walk out, di ba? So if my appendicitis and ang covered is 80,000, and if the average is 80,000, then I can go in, just show my PhilHealth card, or they can access it, then I can go out na 80,000, di ba? Ngayon, kung ang hospital ay 120 ang singil niya, I have to pay 40. But the average should be 80. Pero dahil napag-iwanan kayo sa estimate nyo ng presyo, halos walang no balance billing tayo ngayon.
Mr. President, the no balance billing applies to indigent patients. So if they're assessed by the Medical Social Service as indigent, whatever PhilHealth pays is deficient, if it's kulang, it is covered by what we call quantified free service. That's the income of the hospital. So from whatever revenue the hospital earns from whatever, that's what's paid for the indigents.
Well,
so ang may out-of-pocket
let me ask you
ay
this,
yung,
Mr. Secretary. Mr. Secretary, ilan sa Pilipino ang indigent? Ilan percent?
17, 19% is considered below the poverty line.
Kasi tanungin mo sa kahit kaninong congressman, tanungin mo sa kahit kaninong senador dito, lumalapit sa amin dahil kulang ang pambayad nila, pero indigent sila. Tapos, magkano po yung maip nyo? Mr. President, Mr. Secretary.
Last year,
This year.
50, this year was 58.
58, di ba?
58 billion.
So, napopoliticize tayo. Not politicized in terms of being partisan, but politicians would rather humingi ang pasyente, may mabibigay sila. Samantala, kung ang gagawin ng PhilHealth, aayusin yung presyo, tapos aayusin yung no balance billing, at aayusin nyo kung anong definition ng indigent, hindi na natin kailangan ng ganyang kalaking maip.
I agree, Mr. President.
So why are we submitting I think from the House, naging 70 billion ata yung maip And then when are we going to do the new survey sa case rate?
Actually, Mr. President, what we proposed was 26 billion MAIP, but it has been increased, I heard, to 70.
That's what I'm saying, Mr.
The GAB.
Secretary. During the pandemic, we kept saying, let's listen to the doctors, let's listen to the scientists, not to the politicians. But your budget reflects the opinion of politicians who want to hand out, including me. No one's innocent here. Kasi kung ang pasyente kailangan ng pera, gusto natin tulungan, whether it's from our heart or whether it's partly politics. But the technocrats, the doctors, the people running PhilHealth shouldn't see it that way, di ba? You should fix it. And
Yes, Mr.
nakikita, I'm not excusing the CEO. He's had some run-ins with some congressmen and senators. But what I'm saying, you're the Secretary of Health and you're the chairman of the board. So if you moved to ask the board to do the new survey for the case rate, kung inayos nyo yon at inayos natin po at aayusin natin sa taon na to, sa dadating na taon, yung mga packages, yung binibigay natin sa MAIP, pwede natin either ibigay sa PhilHealth or baka hindi na kailangan, less hassle pa for everyone. If you saw the interpellation of Senator Bongo to Senator Amy kanina, telling the DSWD, this patient has 85,000, nabigyan ng PCSO ng ganito, nabigyan ni ganito ng ganito, nabigyan ng MAIP ng 10. So they still have to pay 60,000. So sabi naman ng DSW, they can come to our office. So sabi nga ni Bongo, di pupunta pa sa opisina mo, di mag-a-absent pa ng half day or 1/3 day. Tapos pipila pa yan. Tapos bagong papeles na naman, di ba? So, I envy 2013 and 2014 where the case rate was close to the real price and people actually started believing in the no balance billing. But now, it's a joke. Di ba, Mr. Secretary? So may I request, Mr. Secretary, that PhilHealth and yourself as the chairman of the board deeply look into this. And this may be, I hope this is the last year that we don't relate the MAIP sa stunting, sa nutrition, sa PhilHealth. Di ba?
I agree, Mr. President.
Well, thank you for that. So, just on my last topic, Mr. Secretary, nabanggit nyo rin, again, in relation to stunting, but to talk a little bit about the local issue, nagka-problema kayo sa pag-purchase ng vaccines? Nagka-problema ba ang DOH sa pag-purchase ng vaccines?
There are some delays in procurement, the usual, what you call this, failed bidding, and then delay in delivery and all that stuff.
Wala dapat problema sa failed bidding kasi pag nag-fail yung bidding, then you can proceed another way, hindi po ba?
That's correct. That's correct.
Bakit po nagkaroon ng delay sa delivery? Wala na naman pandemic, wala naman supply chain problem anymore. So, we can discuss why later on, but has this been resolved or is it a continuing issue?
Yes, it's being resolved. Actually, I know for a fact that some of the vaccines that should have been
Yes.
delivered months ago
Sorry, Mr. Secretary.
have started to become
Have been
delivered.
resolved or is resolved?
Has been resolved.
So, hindi na mangyayari to. So, next year, hindi.
Hopefully.
Yeah.
Hopefully.
So
Mr.
I don't know
President.
if this was brought to your attention. I'll give you an example. No, sa Taguig, need to treat 466 DSTB for 4 months. Total number of TB patients to be treated is 6,677. The Regimen 1 TB meds for drug susceptible tuberculosis, Regimen 1 comprises of maintenance phase and intensive phase. Maintenance phase, isoniazid plus rifampicillin stock out already. Intensive phase, isoniazid plus rifampicin plus pyrazinamide plus etampudol, good for 360 patients only. Is this only in Taguig or is this in the whole country?
It's in the whole country, Mr. President.
So, don't we see a big problem here? Kasi pinagtatawanan na tayo ng mga bansang na-eradicate nila yung TB. Sa atin, grabe pa. And ang tsansa natin is through, the very good program of DOH in dealing with this and giving free medicines. Pero pag delayed ito, di ba, ano epekto itong delay dun sa mga may TB ngayon?
Yes, Mr. President, the delay in delivery was that the winning bidder was unable to deliver and wrote the Department of Health that they cannot deliver. And it seems that
Have you sued them, Mr. Secretary?
no, we just canceled their contract,
So-
and then we asked for a rebid because when we searched what the problem was, it was a global shortage supply. It's not only the Philippines suffering a decrease
Well,
from.
Mr. Secretary, the carrot and the stick works. In all other agencies, pagka hindi makadeliver, may damages yon. Di ba? So, ang problema, kung panay cancel lang natin, it's not only to you. I told DPWH the same thing. No one will say na all of our contractors are saints. Pero the DPWH doesn't punish errant contractors. Kaya lumalaki ang ulo. So, if you don't sue them, so for example, may shortage sila. If US will sue them if they don't deliver. If Switzerland will sue them if they don't deliver. If Japan will sue them if they don't deliver. Tayo, we just cancel their contract. Who do you expect them to deliver to later on?
It wasn't just a contract, it was just an award. So there was still no contract. They refused to sign the contract because they couldn't deliver.
Well, anyway, Mr. Secretary, ang point ko lang po, vaccines ay masyadong maselan. Hindi po pwedeng ganito ang abutin natin. And it's not only for TB. So for example, target eligible population in Taguig for pentavalent vaccines, di ba? Tetanus, diphtheria, pertussis, hepatitis B, influenza. You delivered 6,775 doses by March, January 25, by March, ubus na. Ang target population is 28,000. Nag-deliver ulit ng PCV-10, 1,680 by May, consumed na. Diba? Kasi if you told the LGUs you can't deliver, many of them would have bought. Okay. Last point. When's the last time that we talked personally, whether on the phone or tayong dalawa, Mr. Secretary?
Last year, around September.
And what did you
Before.
promise me, Mr. Secretary, during that time?
I promise you that I will assist the city of Taguig if in case the health personnel of Makati pulls out in the health centers of health centers and hospitals.
Correct me
of
if I'm
the city of
wrong.
Taguig.
I told you, follow the law. I'll help you get confirmed muna, but make sure that the people of Embo do not suffer. The next thing I heard, you were on radio kay Anthony Taberna saying wala kang magawa. Kaya ang gagawin mo na lang, you will give mobile clinic, you will give medicines, you will give people to help. Kasi yung isang nagko-commercial na better daw ang Makati, ang totoo bitter, hindi better. Kasi kinandado lahat ng health center. So may I ask, did you send one piece of medicine?
Yes, Mr. President.
No, you didn't, Secretary.
Actually,
You didn't.
I sent all that was supposed to be sent for Rembo used to be sent to Makati. Now, after the court ruling, we decided to compute all the vaccines, medicines per capita and send them to the City Health Office of Taguig.
I won't argue with you,
we
but
even-
everything you said dun kay Anthony Taberna, you did not do. You did not send mobile clinics, you did not send personnel, and when Mayor Lani called you, instead of addressing her concerns, ang sagot mo, write you. Sabi mo, sulatan mo na lang ako. And then sinabi niya sa'yo na, Sir, please talk to your focal person because she is unbiased. She's a very good person and she knows what's happening to Taguig. What's happening in the Embo. Did you talk to the focal person, Mr. Secretary? Do you even know
Yes.
who your focal person for Taguig is?
Yes. At that time, we even
So who's your focal person
I
for
even
Taguig?
added a new regional director for Metro Manila para more experience.
No, but who is your focal person for Taguig? Every city has a focal person, di ba?
Yeah, DOREP, the DOH representative.
Yeah, so who is your focal person for Taguig? You do
Talked to
not
the
know.
RD. I talked through the regional director.
So you did not
I
talk to her directly?
I do, because we also have meetings about
Oh, what
Taguig
did she
in
tell
Makati.
you? What did she tell you?
For example,
Did she tell you nakakandado lahat ng health center?
yes, alam namin na kinandado. Because remember, the agreement was after September 1,
They would turn over.
turn over, and then they didn't.
And then
kept
they
their
didn't, then you
personnel
disappeared.
until
Then you
this-
went on radio saying wala kang magagawa. On the other hand, Secretary Benhar went to the City Hall of Makati and demanded that they open the fire station for public service. Did they
Magkasama po
report?
kami ni Secretary Benhor to
Well, yung
we
naka-
talk to the city mayor.
Apparently not, kasi yung nakakandadong fire station nakabukas na.
Ay, after
Yung
po kasi
nakakandadong
kinandado
health
yun.
center nakasarado pa rin.
Yung pong kandado ng was after December na. When
Mr.
they pulled out
Secretary,
their personnel.
kinandado yung sa inyo ng September, October. Kinandado yung fire station ng December 31, napabuksan namin ng January. So it's not true that you cannot do anything. Did the focal person talk to you about Hospital ng Makati?
Yes.
What's happening in Hospital ng Makati?
So,
Are patients from Embo being inaasikaso ba ngayon sa ospital ng Makati?
Opo, ang nawala po
Hindi, sandali po sir. Sabi niyo opo.
Opo.
Hindi, hinahanapan sila ng yellow card. At dahil
Opo.
taga-embod na daw sila, humanap na lang daw sila ng ibang lugar. And then, yung MAIP, what is the status of the MOA with MAIP in the ospital ng Makati?
Unsigned pa po, Mr. President.
For how long?
Matagal na, ilang buwan.
8 months.
Oo.
That's okay sa inyo?
Hindi po, hinihintay namin yun. Tina-follow up namin yung signing of the...
So ilan na po ang namatay between the time na hinihintay nyo hanggang ngayon? So ibig nyo sabihin, sino ba nagbibigay ng lisensya ng ospital?
Actually, nagbabayad po kami through our own MAIP for the patients of Taguig.
Yes, but
Go
they have to be shuttled to other places na malayo sa kanila.
Yung napunta sa ospital ng Makati,
Anyway,
sa
Mr.
MAIP
Secretary,
ng DOH po,
y- y-
ginasagot yun.
I want to be respectful, but I'll tell you what's in my heart. We thought you were a Solomon. Now, when two mayors with conflicting claims come to you, and they say, hatiin na lang yung bata, yung isa sabihin, wag hatiin, yung isa sabihin, sige hatiin, you be a Solomon at kampihan mo yung nagsabing, wag hatiin. Kasi yun ang tunay na nanay eh. So you have one mayor who says, hindi na kayo Makati, bawal na kayong paggamot dito, hindi namin babayaran, hindi namin tatanggapin MAIP. You have one mayor who says, ikandado na lahat. And what did you become? Not a Solomon. You became a Pontius Pilate. Naghugas kayo ng kamay. Hindi nyo pwedeng i-threaten yung Makati Hospital na hindi nyo bibigyan ng lisensya unless tanggapin nila yung MAIP. Sa nga nakakita, binibigyan ng MAIP, ayaw tanggapin. You're telling me that the DOH is helpless? Mahiya naman tayo. You have a 300 billion budget. Kayo nagre-regulate ng hospitals all over the country. An ordinary hospital director can say you, wait hanggang mamatay kayong lahat. Anyway, Mr. President, I'll stop there and I just wanted to put on record that we're doing our best. Lahat ng hindi nyo gagawin namin, but we expected more from you. Maawa kayo sa mga taong nandun. 300,000 people. Nakakandado yung health center. So kung kayo naniniwala sa better, ako na nagsasabi sa inyo bitter, hindi better. Thank you, Mr. President.